Thank you. A few weeks ago, it was a Saturday morning. And for some of you who know that, I do see patients at the VA on Saturdays. I had my list of patients to round on, and I was in the middle of my rounds when one of the nurses calls me from the hospice unit and says, we have this patient who's still in pain. So I go out, leave everything that I was doing to see this patient who was in pain. I open the door, and I see this 51-year-old African-American male who had the most beautiful, bright eyes, and the smile could light up the entire room. As I walked closer to him, he was obviously sick. He obviously had advanced cancer, and we started talking about his pain management. We had a conversation for about 10-15 minutes, and I thought I was done. So I turned towards the door to leave the room when he called me, and he said, "Doc, do you have a few more minutes?" And that's usually what happens, right? You see a patient, and as soon as you're going to the next patient, the patient wants something else. So I turned back, and I said, "Of course." And so I go back to him, and he says, no, I want you to pull a chair and sit next to me. So I pulled a chair, and I sat next to him. And the next 45 minutes was time that I was not prepared for. He was talking about not only his past, not only his ups and downs, not only his celebrations and tribulations, not only his failures and his learnings, but also about his relationships. And then came the crux of our discussion, which was his fear of dying. And I have to tell you, I did not have a patient-physician relationship with him. This was the first time I had ever seen him. And he was talking about his fears of leaving. He was talking about his fears of closing his eyes and never waking up. He was talking about his fears of being able to talk to his mother, who was the closest person he had in his life. He was afraid of showing his emotions. I didn't know his faith system. I didn't know his belief system. I didn't know that he was spiritual or not. And here I was. I have to tell you, this was one of those conversations that I've been at high alert. And normally people who know me know I multitask a lot. But this was one incident where all my senses were at the highest level of alertness. I was trying to listen in between the sentences he was speaking. I was trying to look into his eyes and understand what he was seeking. I was trying to look at his body language and feel what he was feeling, and it was difficult. And so when we come to what we feel and what we have to deal with when it comes to end-of-life care, it is difficult for us as providers. It is something that we have to become comfortable with. It is not a one-time conversation. It is an ongoing conversation. It is not a one-discipline issue. It is a team issue. It is a team that consists of a social worker, a care coordinator, a physician, a nurse practitioner, a chaplain. It's the entire team that deals with the patient. It is about the fact that we here in the US spend 25 to 30% of healthcare dollars on end-of-life care in the last year of a patient's life. Of that, 40% is spent in the last month of a patient's life. It is about the fact that there is variation. There is variation that's threefold without improved outcomes. The commissioner talked about how fragmented our care was towards the end of life. Our patients here in New Jersey see an average of 11.3 physicians or providers in the last 6 months of their life. Over 75% of our patients actually get hospitalized in the last 6 months of their lives. When you look at disparities, there's a higher incidence of African Americans and Hispanics actually being hospitalized in the last 6 months of their lives because we haven't overcome those cultural barriers. When you look at issues around fragmentation and the solutions that are needed, they are at dearth, right? The Affordable Care Act does not address those. So there are going to be programs like our Accountable Care Organization or the PACT program, the physician-aligned care teams at the VA that have to work on dealing with care along the continuum. It is about changing the mindset where health is not just about living, but health is also about dying. There is quality of life there. And when we put our patients and subject them to to 11 physicians in the last 6 months of their life. Are we really saving their lives? Are we prolonging death? Those are some of the questions that we have to get comfortable with as a provider community. And we have to work with teams on getting comfortable with those issues. So going back to the story, 2 weeks later, again, that Saturday, I'm rounding, and the nurse go to the hospice unit. And the nurse says, obviously the patient's very sick now. He's not responding. He's chain stroking, and these are his last moments. I walk into the room. He's very comfortable, in no pain, not responding. And then I walk out of the room. I spend a few quiet moments with him, alone. I walk out of the room. I speak to the nurse to make sure that the family is aware of what's happening and it's imminent. And I turn back into the room and he's passed away. So this is what it's all about. It's about one human being at a time. I don't know if I made a difference in his life or his death. I know he made a difference in my life and my learning.